at UNT Health Science Center in 2016. She then completed a dual MD, MPH, which is Masters of Public Health, degree in her emergency medicine residency at McGovern Medical School at UT Health Houston in the Medical Center. Dr. Alfred's goal is to make a meaningful contribution to the community by striving for diversity and equity within healthcare. As a proud member of Gold Humanism Honor Society, Dr. Alfred also aspires to improve trust in healthcare amongst marginalized populations by providing more personal, culturally conscious care for her community. When she is not at work, she enjoys strengthening her faith in Christ, amen, creating music, she can really sing, y'all, playing the piano, and singing. It is with great honor that I present to you Dr. Micheal Alfred.
Thank you, Dr. Renfro. Okay, so I have a couple of disclaimers, okay? I, as Dr. Alfred, I am an emergency medicine physician, so my perspective is going to be coming mainly from the emergency medicine or ED standpoint. Number two, there's a couple of things that might be a little bit different with regards to the perspective that has been given so far. Mr. Baker, Dr. Renfro have been doing a great job, and y'all have been having some amazing questions. So when it comes to the questions, I might phone a friend or two or three or the whole panel, just because I think that they have made some great, fantastic points, especially from like the primary care standpoint, the preventative standpoint, things that I don't quite focus as much on the daily. So going on to heart disease, one thing I want to talk about first is why are we talking about it here? So compared to our white counterparts, we are 30% more likely to die from heart disease. Okay, number one. Number two, we are 40% more likely to have hypertension or high blood pressure, and we're less likely to have it under control. Okay. Number three, we are 60% more likely to be diagnosed with diabetes, and last but not least, at least compared to a 2018 study that was conducted, we are 1.3 times more likely to be obese. Now, as far as the disparities and the gap, there are a number of factors. So we talked about diet and exercise. That's very, very important. But I included the slide not to go through all of this because you see it can't even read it from here, right? But there are a number of factors that contribute to these disparities and why we are at higher risk for these metabolic issues, whether it be heart disease, diabetes, hypertension. Not so much cholesterol, but we are a little bit higher risk. One of the factors we don't think much about is like institutionalized racism. As Dr. Renfro mentioned before, that's a whole other topic. This is like a whole course in and of itself. But the point of this slide here is to show you that there are a number of reasons why we are at an increased risk for these diseases. All right, so what is coronary heart disease, which is the same thing as heart disease, it's just a little bit more specific. It is the disease of blood vessels that are affecting specifically the heart muscle. Okay, so we've already talked about hypertension, we talked about diabetes, not so much high cholesterol, which is atherosclerosis, and that's the plaque buildup within these blood vessels. So the main point here is that our heart muscle and really all the tissues and organs in our body need good blood flow. The way we put it in the medical world is perfusion, good perfusion, because in the blood vessels, these red blood cells are carrying oxygen that our tissues and our organs need. So it's really important for us to make sure that that system is flowing smoothly. Now, when it comes to high cholesterol, that means basically the plaque buildup within these blood vessels. So if you see on the right-hand side here, you have the pictures of the hearts, and underneath you have the blood vessels. On the leftmost side is really good blood flow. Those red blood cells are moving and getting to the tissues and organs as we would like for them to. The second one, the blood vessels, you see there's a little bit of plaque buildup. That's fatty deposits, that's cholesterol deposits, that's starting to narrow the blood vessel in and of itself. So now the red blood cells have a little bit more of a difficult time traveling to the heart, to the other tissues, to the other organs. On the third part, you see that's pretty severe atherosclerosis or pretty severe cholesterol buildup, where you have this little bitty passage where the red blood cells can get from point A to point B, essentially. Now, when you have complete occlusion, or basically builds up to the point where the blood vessels can't pass, then you are in really big trouble, especially when we're talking about blood vessels that supply or get to the heart itself. So you know the heart pumps blood, but the heart also needs the blood vessels to do its job, Okay, so when you don't have good blood flow, that causes issues. I've broken down the consequences of bad blood flow into two parts here. You see, number one, there's a plumbing problem. Okay, so with that bad blood flow, you get damaged heart muscle because that heart muscle needs the oxygen, and if it's not getting oxygen over time, it creates damage. When you have damage to that heart muscle, then you're starting to look at an inability for the heart to really pump the way that it should. Okay, and that in consequence leads to heart failure. Now, heart failure can also be caused by the hypertension or high blood pressure that is causing more pressure onto the heart because now the heart has to work harder to try to push that blood through those blood vessels. Okay, and over time that can weaken the heart as well. All right, the second part is an electrical problem. So we think about heart muscle as muscle, but even within this heart muscle or the tissues in the heart, there are little cells that have basically electrical conductivity purposes, right? So you see the yellow lines, which are like wires. It's not like an actual wire, but there is an electrical conduction system within the heart. This also needs good blood flow, okay? And when this does not get good blood flow, now you're messing with the electrical conductivity, and that can result in having an irregular heartbeat, and that can present in a variety of ways. It can go from atrial fibrillation, ventricular fibrillation. So as far as what this looks like, it can be anything from feeling like your heart is racing, palpitations, a flutter, all the way to sudden cardiac death. The fancy way is like VTAC with no pulse. Main thing here is that it can affect the electricity of your heart, and that's why you have some people who have pacemakers or defibrillators that are implanted. That's why in certain cases of CPR, we put the pads on to see if there is an electrical issue that can be fixed with a shock. That's because there is an electrical conduction system within the heart muscle. All right, so what are the risk factors? A number of risk factors contribute to heart disease. Hypertension, high blood pressure, we've been talking about that. Diabetes, okay? Cigarette smoking, vaping, tobacco use. Obesity, or being overweight. Infection can as well, and we see that in like staph infections sometimes, or like a rheumatic heart disease, but we aren't talking about that as much. Drug abuse. Big things that come to mind for me are crack and cocaine use. Reason being is because these particular drugs constrict or narrow those blood vessels, which basically gives you the same effect as a hypertension. Alcohol use can also damage the heart muscle. Okay, if you drink a lot of alcohol for long periods of time, you can predispose yourself to a risk of developing what we call alcoholic cardiomyopathy, which is basically like a heart failure. Caffeine can do it. It's kind of like a stimulant. Same effect on the blood vessels as narrowing it, increasing your blood pressure. And some medications can as well. One of these medications I actually hadn't thought much of until earlier today was that what we call NSAIDs, so the pain medications like ibuprofen or Motrin, Aleve, if taken over a long period of time, that can actually affect your heart and predispose you to an increased risk of heart disease. Now, how does coronary artery disease present? Now, coronary artery disease basically has to do with the blood vessels, whether they're narrowed or have plaque buildup. This can result in a heart attack. Remember before I talked about the complete occlusion or blockage of the blood vessels that supply the heart. If you have that blockage, now your heart isn't getting the blood that it needs to function, and then that can result in a heart attack. Symptoms of a heart attack include chest pain that go to your left arm, your neck, sometimes your jaw. I had a patient who thought that she had like a tooth infection, okay, but she ended up having a heart attack. This was a patient who was out at LBJ in the hallway and everything. But all in all, that being said, it can present unusually, okay? There are cases of heart attacks that can actually present as an abdominal pain, especially like in the epigastric area, which is like right near the chest, okay? You can have sweating, you can have shortness of breath. If you feel any of these, be sure to call 911 because just like time is brain, time is also heart. The second way that this can present, and the more unfortunate way, is cardiac arrest, okay? And this is like the massive heart attack that people talk about, others passing from. Oh, they had a massive heart attack. It's that sudden collapse and death. If this happens and you don't find a pulse, so I like to check for a pulse right around the neck. That's one of the biggest arteries that you can check for to see if somebody has a pulse. If you don't feel one, start CPR immediately. And if there is an AED, which is like the electrical device that is located in like a lot of public areas, if you can find one of those, find those as soon as possible, because those have the pads that basically give the shocks before 911 can get there. In the case of cardiac arrest, there is a pretty good chance that the rhythm or what's going on with the heart may in fact be electrical, and that's what makes the AED so important. This doesn't relate to coronary artery disease, but like in the case of Damar Hamlin, for example, when he was out on the field and he had gotten struck in the chest, that affected the electricity or the cells that conduct electricity at such the right time that it caused him to have that sudden collapse and death. And that's why having that AED on the field was so important. And that's why he's here now, because they were able to intervene early. So when you see these things, well, if they collapse and die, or try to die on you, check for the pulse. No pulse, start CPR. If you have somebody else around you, have them call 911 as soon as possible, locate the AED, put those pads on, and continue CPR until the paramedics can get there. All right, now heart failure. Heart failure is that impaired ability for the heart to pump the way that it should. When you have a decrease in that function or that pumping, that can lead to these symptoms here, such as leg swelling. Specifically with the leg swelling, if you are able to put your finger on your leg, leave it there for a couple of seconds, apply a little bit of pressure, then you let go, and you have this little pitting mark, that especially may suggest that you may have some sort of component of heart failure. Now keep in mind, heart failure comes on a spectrum. Okay, it doesn't mean that your heart isn't pumping at all, but it may be functioning less than it used to, or it could be a pretty severe heart failure. There's a whole spectrum. You can also see gradual shortness of breath or increased shortness of breath when you're exerting yourself during exercise, for example, or an inability to lay flat. So if you find that you lay down and you are short of breath and you need to sleep on top of 5 pillows, then that could be, in fact, a symptom of heart failure. Okay? I just mentioned the shortness of breath with exertion or walking, and decreased exercise tolerance. Okay, so if you're exercising, you get lightheaded quickly, as well as shortness of breath, possibly it could be a heart failure issue. And then last but not least, the cardiac arrest or sudden death. All right, so prevention and next steps. Rinse and repeat, because these things are very important. Annual doctor's visits, plus or minus a cardiologist, depending on what you are dealing with, okay? So if you already have diagnosed heart failure or a diagnosed abnormal heart rhythm like atrial fibrillation, your cardiologist may see you, or they may put you or refer you to a specialist, what we call an electrophysiologist, right? Who deals with AFib, atrial flutter, these other abnormal heart rhythms. They help with the pacemakers, defibrillators, and what have you. Let's start off with your PCP, your regular doctor, and see if you need to be referred from there, okay? Diet and exercise are super important. Very important to make sure that you stay active so you're not sitting down all day. Right, you want to make sure that you are working your heart so that it can get stronger and stronger, and then of course diet, as we talked about before. Okay, taking prescribed medications, I can't stress this enough, because as Dr. Renfro had mentioned before, hypertension and diabetes, as Mr. Baker had mentioned, are silent killers. Right, just because you feel good does not necessarily mean that your body is in great shape. I had a family member who felt fantastic, and I just randomly decided to measure her blood pressure. It was 230 over 120. And I, as an EM doctor, don't really like to put people on regular medications, but I'm like, okay, in this case, we need to get you on something before you get into some really, really big trouble with a blood pressure like this. I know you feel fine. I know you are going about your daily activities like nothing's going on. But with blood pressures like that, you really need to do something. So it's important to check in with a primary care to make sure that your blood pressure is under control. All right, and then the stress test. So if you're a male who is over 45 years old or a woman over 55, it's important to get that stress test, because during that stress test, we put you under exertion and we kind of keep track of how your heart is functioning through EKGs, which is like the measurement of the rhythm in different parts of the heart, right? So we call it a 12-lead EKG. We see this in live time as you are exerting yourself to see if there are issues with blood flow as you're exerting yourself versus at rest, okay? They'll also do like a stress echo, which is like an ultrasound of your heart to look at how your heart is functioning through these exertion exercises, if you will. Okay, Let's see. I think I pretty much covered it. Okay, so yeah, if you have high blood pressure, diabetes, heart disease, high cholesterol, stress test is important, okay? Family history of heart disease, especially if you have a family history, because now you have an increased risk of these conditions. And if you have symptoms of the heart disease that I talked about or heart failure, then a stress test would be very beneficial. Especially if you say, oh doc, man, I'm feeling quite short of breath and lightheaded when I'm working out. This gives your doctor a chance to see what is going on when you develop that lightheadedness and shortness of breath. They get to check and see in live time what's going on with your heart. And then if you are inactive, make sure you just, keep tabs on what's going on with your health in general. And a stress test would be a part of that. Any questions so far?
Yes, sir. Doctor, a question on the blockage.
Mm-hmm.
I've known friends that went in and had stents put in.
Mm-hmm.
So when you have some blockage, a minimum amount of blockage, is that the only way to correct it? It's no medicines or no exercise, no diet that could turn that around?
So yeah, when you're dealing with a blockage in the heart, now you're dealing with like actual plaques, right? So diet, so in a way, I guess certain like grains, whole wheat can help lower the cholesterol, but you really need to get rid of that plaque. And that's why they had to get the stent. So the cardiologist has to go in there, basically remove that plaque, okay, and then they put a stent there to make sure that that blood vessel stays open. Some of those stents have drugs to keep the blood flowing, like a blood thinner, to make sure that that stent doesn't get all calcified and blocked up again. So if you start to have a really bad blockage, you gotta get it removed. In some cases, it's like an emergent procedure. If you're having like a pretty much near massive heart attack, they take you to the catheterization lab as quickly as possible to get that removed, and then they place the stent. If it looks like you have a pretty decent amount of that plaque buildup, they may schedule you for a catheterization, and they may go ahead and will first kind of inject a dye to see, how well it's flowing through the arteries, and if it's not flowing well, then they go ahead and put in that stent. So when it gets to that, then medical intervention may be more beneficial.
I had the same question that he had. With the plaque buildup, and I guess common sense tells us that exercise would be something, I guess, to eradicate it or eliminate it. Are there medications that you can take also? You talk about diet. If you change your diet and you're eating well, will that plaque eventually go away? Well, how do you get rid of the plaque?
That's a great question. I'm actually give it to the panel because as far as I know.
So that's the point. Once you're there, you're there. So the whole point is, let's say if you go and you get that cath, right, that cardiac cath, and they clean out your vessels, you got new stents. That is now the time to change your diet. Because you see what I'm saying? Because once you have, it's literally like glue stuck together. Like there's nothing you can really do to get that out of these small vessels. But you do have the opportunity to change your diet later. But yeah, if you already have really bad plaques, you're in a bad situation, and that's what we're trying to prevent. And if you can't prevent it, that's why you go see your doctors, that you can know before you have a heart attack that you are at risk of having a heart attack.
And then they can go ahead and remove the plaque. And then the drugs are really to help thin the blood so that they can move through whatever pre-existing plaque is already there.
Yeah, would you revisit the caffeine